Good afternoon. I'm George Latimer, Westchester County Executive. I'm here with Deputy County Executive Ken Jenkins to give you the coronavirus update for Monday, January 25th here in Westchester County. The numbers that we have from the tracker have not been updated for today, Monday the 25th. We're working off of numbers from yesterday. We've risen year to date or overall pandemic to date of 89,225 people that have at some point in time tested positive for COVID. We have active cases now at 11,600. That number has been relatively flat for the last week. It's gone up a little, gone down a little, but it's stayed at about that 11,500, 600, 400 range, which basically tracks how many people are contracting the disease right now versus how many people have completed their 2-week period of time where the virus could incubate in their systems. And we were getting roughly about the same amount of positives 2 weeks ago as we are now. I think we're starting to see the end of the spike that we got at the holiday season, the New Year's holiday season, New Year's Eve holiday season, and what followed Christmas and way back to Thanksgiving. Our fatalities have reached 1,846 deaths. The numbers of those we've lost have been growing in a more significant fashion, 5, 10, 12 people a day, compared to going through long periods of time where we had no fatalities during the summer. But we're past that reference point now. We're in the middle of whatever is a second significant outbreak of the infection, and we're trying to make some comparisons to the first round, where we have the same number of active cases but less people hospitalized, and that's a good thing. Right now we're down to about 550 people hospitalized with our last number that goes back 3 or 4 days. The fact that we are at that point is still below half of what we were at our peak hospitalization back in the spring of last year, when it reached as many as 1,200 people hospitalized. But both the fatality and the hospitalization numbers are still significant, and we continue to look at the outbreak as being one that's very serious, because we are now dealing with the UK variant, which we've all heard a lot about. And that UK variant represents a disease that is more communicable than the original strain of COVID that we experienced when we first looked at the outbreak as it came in March of 2020. There's been some desire for people to know whether the UK variant has been tracked in their municipality or not. The number of cases is still relatively small in Westchester County, but the bottom line is it's highly communicable. So no one should say, well, if it's in my town, I am more worried. If it's in somebody else's town, I am less worried. It is now part of the communicable stream, meaning that it could spread. But again, it is not a more severe case of the virus, as we are told by the medical professionals. It is not as if the UK variant is somehow resistant to the vaccines. It is not, or that somehow it causes fatality more frequently. It is a variant of the original type of coronavirus virus, and it represents something that can be more easily contracted based on the construct of the protein in the virus. So, the viruses don't see dotted lines. They don't know this is where one village begins and the next town next to it begins. So the only practical response to knowing that the variant is in Westchester County is to wear masks and to socially distance, to stay out of large crowds of people, make sure we sanitize our hands so we don't pick up things from the surface, and all the things that we've been told now for 10 months, 11 months. That is the response that we have to have. But yes, the UK variant is here with us in Westchester County, and that is of great concern to all of us. I want to highlight the issue that just came up late on Friday when the governor tasked local county health departments to make the decision on whether or not high school sports would resume. It is quite the decision, but we're happy to have responsibility in these areas. I often talk about how the state has reserved for themselves the responsibility to make decisions on a wide range of areas. They have decided when and where the vaccines go. They have decided when and where access to nursing homes would be governed. They've determined what kind of data is shared back to the local governments and which kinds aren't. In this particular case, and this is a bit of a controversial decision to make, they've kicked this one down to the county level of government. I must add, not to the county executives, but to the county Department of Health commissioners. And so the actual decisions are made by those individuals in each county. Now, reopening high school sports has a multiple number of issues involved. This morning, both Ken and I were part of our weekly call with school superintendents. We actually reached out over the weekend, and they are now compiling data on some key areas that represent how we would go about opening up high school sports to make sure we can do this safely and properly if that's the place we get to as a decision. We know there's some people in the society that say, don't even discuss the issue, don't open it up. And there are some people who say, we've waited long enough, open it up. And I take the same attitude on this issue that I've had on other decisions where we've had the authority to make them with county recreational facilities. We don't open up everything automatically. We don't close everything automatically. We make a judgment call. And I have long since talked about during the heart of last year how we made decisions to keep our public golf courses open, public decision to maintain our Bicycle Sunday program. Ultimately, we were able to open 4 of our county pools and 2 of our beaches for the relief of our county residents, and we kept our nature trails open. On the other hand, we canceled ethnic festivals, we canceled fireworks, and we closed Playland Amusement Park, although we kept the boardwalk and the beach open. The amusement park itself was closed. We made those decisions based on one factor. Could we provide the recreational service safely? Not should we close everything philosophically or should we open everything philosophically? And the decisions we made last year turned out to be the right decisions. Those decisions did not spread the disease. The spread that we've seen lately did not happen until we got late in the year with certain social actions in late October, November that started to spike us up, but not to the recreational programs that we had during the summer that we were able to maintain. We maintained kids' camps in a reduced fashion in some of our county parts. We were able to work through this. So that is exactly what we're trying to do now. We have tasked the schools with coming back to us with a plan in which they work with their sports directors. And some of the key elements are, number one, there are a series of high-risk sports that have been identified as not being able to start up that now the door is open to starting up. Football, basketball, wrestling, there's a host of those activities. That is separate from some, like track and field or golf, which are not, they are socially distanced, so they were never on the list of high-risk sports. So we've asked the school districts and the school superintendents to go back and look at all those sports and make some internal decisions. If they're going to manage the process, we may allow this to happen, but when we allow it to happen, there's going to have to be protocols to protect the athletes and whatever there are of coaches and other people that might be watching these sporting events. And in order to do that properly, we need to know from the standpoint of the people that are running the sport, how practical is it to do that and what would you have to do. And I'll just use the same example that I said a second ago. There are some high-risk sports that you can construct a way to perform. Basketball potentially, football potentially. There are some that are going to be very difficult to do, like wrestling. Wrestling involves 2 individuals competing, directly in contact with each other throughout the whole athletic competition. Me personally as a layman, although the door is open to any discussion, it's very hard to see how you're going to have wrestling at a significant level without 2 individuals, being able to keep any kind of distancing. It is conceivable that you could run other sports and you could do that distance. But the school districts have been tasked with trying to come up with these things. They're making decisions about how they advocate for these various sports. We know the sports are important. They're important to young people. For some of them, it is a path by how they go to college and go on to higher education. For some, it is an important release from the stress of what we've dealt with, and many of the parents have been very active of those young athletes to give them the chance to compete again. As they develop the protocol in those areas, we're mindful of 2 other things. The first one is that we're going to have to test at a much more intensive level. We're going to have to make sure that how we handle the potential sanitization of the physical area where the competition is going to occur is going to have to happen if we can successfully have these competitions. And then the second element of all of this is that Westchester cannot act unilaterally, even though the governor left it up to the individual county departments of health. Our high school athletes compete in a Section 1 of sports in New York State that involves Rockland County, Putnam County, Dutchess County, and we need to act in harmony. So I've been in contact with some of the other county executives. As soon as this briefing is over, I'm going to join a conference call with my colleagues from Dutchess County, Rockland, Putnam, and perhaps some of the other Hudson Valley counties, where we're going to talk about this in a mutual fashion. And we hope to have a statement by the end of the week that would involve all of these counties that participate in Section 1 sports, because you don't open it up just for the high schools in our county. If we're competing against those other high schools, it has to open it up on a broad basis. And they have to be a singular set of health responsibilities that each school will have to go to. We will have dialogue then with our county health department. In theory, we'll have a plan together that will represent how we intend to do this successfully, and we'll have to have the resources necessary of testing kits and PPE and so forth in order to make that happen. And the county will have to provide those resources through the schools. We can't expect the school districts to be able to have access to that. They're budgeted and structured around education, not around providing emergency services. So this is part of the cooperation that we've talked about as we go forward, and we look forward to having that dialogue. We'll have an announcement, I suspect, no later than Friday, perhaps sooner, in what direction we're going in. My counterparts in some other counties have already made announcements that they're going to move forward in this direction. Laura Curran, County Executive of Nassau County, I believe, is in this very hour. Steve Pellone, my counterpart, the County Executive of Suffolk County, making announcements that they're moving forward with this. Every area is a bit different area. Long Island is one singular unit of two counties. We have a much more smaller, broken down other jurisdictions that we have to negotiate through a different function. But for those of you who are waiting for the decision positively, negatively, and how it's going to work, just be patient. We're going through our due diligence because we want to make sure if we do open this up that we do this in a safe fashion. And I'm confident that we'll make the right decisions. I understand there are people that would disagree with the decision to open this up at any level, and I respect the fact that we all aren't in agreement on things. But we make decisions, and I've often said when the state holds the power to make decisions, and I'd say, look, if they gave me the authority, I'd be happy to make the decisions. I'm not afraid to make those decisions. I don't make them unilaterally. I make them in concert with Ken and Joan and so many of the other executives that I brought up here to introduce you to from time to time. We have a very intelligent executive team. We have many people operating in many parts of county government that are doing fabulous work. And you may not see it, but that's what's happening. And so I'm going to rely on their professionalism as we make these final choices and decisions. But when we make these decisions, we're also going to be prepared, if things get out of hand, to stop them. We're not going to automatically commit ourselves to a path if, in fact, infections do increase, if all of our athletes do contract COVID. We're not going to continue down that path. I think it's practical to think that we will assess this on an ongoing basis, day to day to day, and make some judgments, and hopefully they'll be the right judgments. But we have that decision in front of us this week. When I give you the report update on Thursday, I'm scheduled to do that Thursday at 2 o'clock. We'll give you an update on where we stand on that. And we will have a separate announcement by the county executives of the Hudson Valley counties relative to sports. But that is where we are in terms of the sports program. We think that it's important. Vaccines have been the number one discussion everywhere you go. Through yesterday, Sunday, January 24th, there were 2 locations where Westchester County government is directly involved in the administration of vaccines. We have our White Plains Health Clinic, where we have in the aggregate delivered 3,327 vaccines, all first vaccinations for individuals. We haven't yet gotten to the point where we need the second shot yet. And at the county center, over that period of time, we've been open about 12 days. We've had 12,838 people vaccinated at the county center, and the response we've gotten from most everyone is that both operations are running very smoothly. The frustration about getting an appointment is not carried through in the way it's operated. The frustration of getting an appointment, many more people at the top of the funnel want the appointment, very few appointments available based on the availability of the vaccine. But once they come into the system, we're getting high praise for the operation that's been done. I want to thank our county Department of Health personnel, our county Parks Department personnel, the executive branch work of Joan McDonald, Emily Saltzman, Christopher Steers, Aviva Meyer, and certainly Renee Recchia and Dr. Amler from the health department, and many others have done a great job at both the county center and the clinic. So 3,300 at the clinic, 12,800 at the county center. In the aggregate, Westchester County has directly administered 16,165 vaccines. This does not include many of the local pharmacies and the hospitals that are also administering vaccines. And so these things, will identify how many people from Westchester have been protected so far through the system. It is not open to all Westchester residents at this point. The limits are the age 65 and older, people who have compromised immunity systems or who work in a particular type of work that's considered essential for the structure of the society, and certainly first responders fall into that category, people in school education, and a number of other different professions. So we have not yet reached the point where we're comparing that number against the full scope of 1 million New Yorkers. We're comparing that number against a much smaller cohort of individuals. But we are still struggling with the fact that the vaccines have not been available through the federal government, and therefore not to the state government. And the governor, you've heard the governor make statements about how vaccine allocations have been cut back. You've heard the new administration of the federal government really jump into this issue with full force and lots of professional efforts. And I think, frankly, for the first time in Washington, you're seeing them take this whole pandemic dead seriously. The only problem is we were in the 11th month of the pandemic, and things that could have and should have been done previously were not. And so here we are, and the federal government is playing a major game of catch-up. And as they're trying to do that, it puts us all in a difficult situation. If we had sufficient vaccines to vaccinate everybody, we'd be in the process of doing exactly that. Right now, we have a limited supply, and we're trying to make sure that the people that are in the designated categories right now, as I've just described, they are by the state standards 1A and 1B, with one element of 1C carried forward, people with immune systems. And so hopefully we'll continue to get as many more vaccinated as we can. And we know that there are people who are finding vaccines wherever they can find it, somebody in the city, somebody someplace else. If you get vaccinated, that's the most important matter. I'm not particularly hung up where you get vaccinated, as long as it's a legitimate vaccination, as long as you can go back for your second shot, all of that should be well. We've made efforts today to make sure that all of our county essential workers are being vaccinated. That's not our full county workforce, but it does include police officers, correction officers, people who work in the Department of Social Service with direct client contact, certainly our Department of Health employees, and all of that is important. We're trying to make sure that the county workforce that fits into that category has their vaccinations, and the people that most need it have it. And we're also trying to make sure that out in the society at large, the people that most need it are getting it. I am eligible to get the vaccine. I'm over the age of 65, but there are people who are much greater advanced age than I am. And so I intend to take the vaccine when I know that the vast majority of people that need it more than I do have gotten it. So I took the interim period of time to get my pneumonia shot, which I hadn't taken yet. That's a once-in-a-lifetime shot. That will take a couple of weeks in my system before I can take the next shot. But just on a personal level, it's understanding that there are people out there who have greater need. And so I would appeal to you, wherever you are in the continuum, if you are eligible for the vaccine, take it. If you're not eligible for the vaccine, wait. Wait until it's appropriate based on the cohort. The people that need it more than you, whatever your own sense of concerns are older people, people with compromised immune systems. We want to make sure that what access we have to vaccines can be satisfied for the best health interest of as many of those people as possible. Now, when we had our correction department folks in today, they came in. These are people who have a very difficult job, very physical job, and they put themselves in contact with lots of individuals, with our residents of the jail, inmates, if you would. And this morning they came in to register and to take some shots. We have a video here that I'd like to share with you with Neil Pellone, who's a president of our Westchester Corrections Officer Benevolent Association, the union that represents correction officers, COBA.
As a union leader, I think it's important to lead by example and take the vaccination and hopefully slow down the pandemic and the spread of this terrible disease. Being first responders working inside a congregate setting, which is a jail, is very important that we're able to receive the vaccination.
Yes, yes. That's always an issue with communicable disease in congregate settings.
Yes. We fought hard to make sure that we were included in the vaccination period, and hopefully you take advantage of it. The opportunity that we're given to be part of Class 1B and get your vaccination and keep yourself and your family and your loved ones safe.
Those who are willing come in to get their shots, those from public safety and other critical departments. We have a system now in place that we think will make sure that the people that are eligible to get the shots here get those shots and administered in a proper fashion. We have on our webpage, westchestergov.com, a variety of information that will give you a heads up on vaccine distribution. We have a list up of various places that administer the vaccine. We highlight who's eligible to take it right now in phases 1A and 1B. And we have the relevant hotline number from New York State. We have the relevant questions about am I eligible, also from New York State, all of which you can look at and see and use to inform your judgment. The forms you need, there's a link on our website, and to try to get you the answers as best as you can. The frustration about getting an appointment is frustration, again, because the supply of vaccine does not equal the demand for vaccine. It does require persistence, and does require some patience, but we will get through this. We will get everybody vaccinated, and we'll get everybody protected from COVID. So the county center has become ground zero for our medical facilities. I'd like Ken Jenkins to give us a little update on what's happening over there so that if you drive by, you'll know what you're seeing. Ken?
Thanks, County Executive. At the county center, if we go back to the times when last year, when COVID was really rampant and the hospitals were just flat out getting overwhelmed, as it's happening right now in the West Coast, there was a scenario that we were running out of hospital rooms and especially ICU rooms in the state. And the governor took the initiative to regionalize all the hospitals, and in doing so, created specific centers. Westchester County Center became one of those centers. And there were 100 plus extra ICU rooms that were created, and we never had to use those, thankfully. And as County Executive Latimer has been pointing out in the weekly reports twice a week, how the hospital beds, especially the ICU beds, have been consistent here in Westchester County, somewhere between 30 and 35% availability. That has given the state, and the state has made an initiative to ramp down part of the county center. The county center was utilized for antibody testing earlier last year in the summertime, and now it is being used as a vaccination center, as the county executive pointed out. If you drive by today, you'll see that there is no roofs on the tent. New York State, the last few weeks, has taken out the guts of the tent area. Obviously, the vaccinations are still going on inside. Those rooms are still available for utilization should that case need to be the case. But right now, those over the next 2 to 3 weeks, you'll see those tents coming down on the outside. That actually should be a sign of the beginning of the relief. That the tents coming down say that we're in a position that New York State says they no longer need those tents in the parking lot as emergency ICU rooms to be able to handle the pandemic. So the vaccinations are going on the inside, while the outside, over the next 2 or 3 weeks, you'll see the tents coming down, and eventually we'll have that parking lot available for the people that are going to the county center. Right now, the county executive has ordered that there is no charge for those people going to get vaccinations at the county center in the parking lot across the Bronx River. Again, the parking lot will not get repaved until sometime in the spring, but no one should be alarmed. It actually should be a sign of relief that things are moving in a direction that the state now feels they can give back the county center parking lot to be able to be used for what its purposes were. Thank you.
Thanks, Ken. Thank you very much, Ken. You can mark on your calendars that this Thursday, in addition to the 2 o'clock update that we'll be giving here on Facebook Live, we will have another one of our town hall questions and answers on COVID. The last time we were together, we had the benefit of Dr. Dial Hewlett from the Health Department, and we had the mayors of Yonkers, New Rochelle, and Mount Vernon with us. This week, at 6 o'clock on Thursday, we'll be joined by Dr. Charlita Amler, who's the commissioner of the County Health Department, and we have Yorktown Supervisor Matt Slater, Peekskill Mayor Andre Rainey, and White Plains Mayor Tom Roach joining us as well. And this is an opportunity to learn a little bit about what's happening in each of those municipalities relative to COVID, because people really do focus on where they live, not just the general Westchester story. And of course, Dr. Amler will give information along those lines. That'll be at 6 o'clock on Thursday. You can ask questions live on Facebook, or you can email them to communications@westchestergov.com. Just as a reminder, this is the month of January, and January is a winter month, and we're going to see some winter weather a little bit on Tuesday, a little bit more, I believe, on Thursday. We have potentially 1 to 3 inches of light snow, possible mix and freezing rain. We've had, except for the one snowstorm in December, a pretty dry winter season since we began it in November, and we might be a little spoiled that we haven't seen a lot of snow. We haven't had to drive through it or dig out. A little bit's coming on Tuesday, and there may be one that comes on Thursday. Now, that one may come south of us. Follow the guys who do this for a living, and they'll let you know. I am not a weather professional, meteorologist, but the weather will complicate travel. Be prepared for it, and we should be well. And then I also want to make a note today, January 25th, is the 13th anniversary from the death of Officer Christopher Ridley, who was a Mount Vernon police officer who was in a civilian setting when, through a terrible tragedy, he was shot and killed right across the street from our county office building in front of Court Street building. He was attempting to deal with a problem and unfortunately was wrapped up in it and lost his life. And we put a monument to his remembrance there. We dedicated it back in September of 2019, so now it's the annual anniversary of when that terrible tragedy happened. It was a commitment made by then County Legislator Lyndon Williams, who is now Judge Lyndon Williams of Mount Vernon, and members of the Mount Vernon community where Christopher lived and served. We're here for that dedication, again, 14, 16 months ago. And the monument will stand for a long, long while to remember not the death of somebody, but actually the life of somebody. The life of somebody who was a very young man and gave himself to public service as a police officer, and a person who lost his life while in the act of trying to save somebody else. We remember Christopher Ridley, and we grieve with his family on this anniversary of his passage. That is our report for the moment. I'm going to go to one. We have some questions, or a question.
We have a question from David Proper from the Journal News. And he asks, what advice do you have for seniors still seeking an appointment and unsure of how to book one?
Well, I think David Proper from LoHUD, the Journal News, I think we fall back on the same basic structure that we've had for a while. Governor Cuomo has indicated recently, since the state structures how this works, that local pharmacies should prioritize vaccinations for people who are senior citizens. So if the senior citizen has a local pharmacy in their area that's giving out shots, then they should contact them directly. That is the new protocol that has been provided to us in the last couple of weeks. Previously, everything was go onto the website and go from there. Now we have approach your pharmacy directly. If you don't know which pharmacies have them, you can go on to our county website, westchestergov.com, where we now have a list of all the pharmacies that have been tasked with this. Now, the pharmacy allocations for COVID vaccines are not, overwhelming. Many of them get about 200, 250 doses at a clip. So that is one direction for that person to go. Another direction for that person to go is to the state website to go on. There are appointments being made at the county center. You have to be persistent. You have to keep looking and trying, because what will happen is something will fall out, opening up a more current available date. Right now, they've booked out well out over 60 days, and that's frustrating for people that want, to have the protection of the vaccine as soon as possible. But there is no other path. As I've said, if the federal government can obtain more quantity, get more of it to us, we can open up more testing facilities, more vaccination facilities. We can extend the hours of vaccination, knowing that we have the product to give out, and we can accommodate a lot more people faster. And we're going to need to do that when we open it up to the full breadth of society, because no matter how many people right now are going through the vaccination process, 65 and older, healthcare issues, and specially targeted industries are in no way, shape, or form the vast majority of Westchester residents. That vast majority, bulk of up to 1 million people, fall well outside of those categories. We are going to need a lot more product, and we're going to need it as soon as possible to satisfy the demand. So, David, persistence is the only answer I have on the website that gets you to the county center, or looking for a local pharmacy in your area that has it and trying to access it that way. Any other questions, Catherine?
Yes, the next question comes from Michael McKinney from the Journal News. Also, he asks, on what calendar date will the county make its decision on whether to start high-risk school sports on February 1st?
I think we're expecting no later than Friday to make the decision, and it's not, as I said earlier, a county-only decision. We have to work in harmony with the other counties of the Section 1 region in order for the full competition to occur. If we can announce something as a group sooner than that, we will. But I think we need to give ourselves the full week. We know the places have made their announcements. Everybody's on their own time frame. We know that February 1st is the beginning date, but we have both the fall season that hasn't occurred and the winter season of sports. And both of those two seasons, we would have to work out a time frame, as well as the coming spring season of sports. So all of that has to get worked out. And if we're going to have a rational schedule, however many games are going to be played in basketball and football and whatever other sports are going to be conducted, I would rather do, as I often say, what my father told me to do when doing woodworking, which is measure twice, cut once. So our cut will come. Hopefully we'll have an announcement by Friday, maybe sooner, and that's the target.
The last question is also from Mike McKinney from the Journal News. Does the county executive believe the governor has given the county and schools enough time to prepare to start high-risk school sports on February 1st? Is starting on February 1st even possible?
I don't think it's realistic to think we're going to start the sports on February 1st. I think we give a green light to the school districts to be able to prepare to have their season start. How quickly, if you're going to start, for the sake of argument, with winter sports first and then try to take the fall sports and condense them into the spring season with the spring sports, I think it's realistic to think that when we begin on February 1st, the first games are going to take some time. to occur. But the bottom line is there's hope. There's an opportunity for these things to happen. If a decision had been made earlier to go down this street, we would have gone down the street earlier. But we were given the information late on Friday, and we've gone as quickly as we think we can. I've had conversations over the weekend with relevant personnel, and I think if we do get to the green light by the end of this week, I don't know when the first games will be, but I think you'll see the process gear up very quickly in the high schools starting Monday, which is February 1st. And while the sporting events won't be on February 1st, the wheels will be in motion for the sporting events. And so to that extent, Mike, I think we'll be showing that we're responding quickly. We do have to be very concerned about the healthcare implications of what happens during a pandemic. So, we can't gloss that over. That's the whole reason why we're going through this as a society. And I hasten to add that Dr. Shalita Amler is the actual decision maker here. I'm going to put together resources and a plan that I think will make sense in concert with lots of other players, and we'll see if that can't be the plan that goes forward with it. So with that, if there are no more questions.
There's one more.
One more snuck in under the line.
One
sure.
more, also from Mike
Yes,
from the
Mike.
Journal News. Can the county or counties essentially give the green light to school districts to make the decision themselves on whether to hold sports?
Well, I think the schools have the decision right as to whether or not their schools will participate in the sports program. Nothing says that they're mandated to participate, and if a particular school district, for whatever reason, doesn't have the resources, has reallocated physical space in a certain way that makes it impossible for them to conduct some or all of the sports, they will have that option to opt out. I don't know what happens in a local district, in terms of the dynamics of those that want to see the sports happen versus those that may not. But we're not devolving the decision down to the locals. The locals have that option to not pursue it if they choose to. We have to create a climate and a protocol that allows all of them to do it if that's what they want to do. And, since the decision authority was given to us 3 or 4 days ago, we are working to try to do the proper job on it. But as I said once earlier in the program, we showed the ability to open up sports last summer in the areas that we had responsibility for. And by the way, if there are any county facilities, track and field facilities, or anything that we can contribute to help make it possible for any local district to conduct their sports program, we'll do that. We already showed that. By the way, we've used Playland for some high school activities around graduation time, hosting a graduation there for one high school and hosting a caravan queue-up spot for a second high school. So we're prepared to be flexible, to work with our school districts and make sure that they can accomplish what they've set out to do.
That's it.
Very good. Thank you all for watching. We'll be back on Thursday at 2 o'clock for an update. If we have anything else, breaking news to share with you, we will. And in the meantime, stay safe, and hopefully the news will continue to get better as we get more vaccine. I'm George Latimer, County Executive. Thank you very much for watching.